Hello, thanks for joining me. I'm going to be discussing a topic and question relative to laboratory management today, and I'm glad that you've joined me. I'm specifically aiming to discuss the topic of how do you make your laboratory into a world-class laboratory? Now, in doing so, I'd like to talk a little bit about some of the quality solutions for the laboratory offered by the College of American Pathologists. Mind you, I am not an employee or paid by the College of American Pathologists. This is my background. I am a fellow and member of the College of American Pathologists, and I have used the materials that I'll be talking about throughout my career. One of the reasons that I want to talk about these topics goes back to a night I spent sleeping on the hard floor in a friend's home, an apartment in Ho Chi Minh City, Vietnam. At that point in time, I realized that I might have an opportunity to really make a difference in helping laboratories there to improve the quality of their performance and thus provide better care for their patients and really more professional satisfaction for them. And so I'm going to talk to you about helps in managing your laboratory, and specifically the laboratory accreditation program, and more fundamental to that, the proficiency testing or external quality assessments that are offered through the College of American Pathologists. To give you a little bit more personal background on my journey on this, I made my first visit to hospitals in Vietnam in 1989. I visited 2 hospitals outside of the major metropolitan center of Ho Chi Minh City or Hanoi, one to a provincial level hospital in Dam Nai province and another provincial hospital in Gan Tơ, which is a rather respectable and very large city in and of itself. That exposure led to a number of other efforts over time to provide equipment or other things. But it really took shape when, beginning in 2009, I began to visit again as an academic and researcher and teacher to provide educational updates at various sites in Vietnam. In conjunction with that, our institution hosted a number of Vietnamese pathologists to provide observerships and some level of training. This reached perhaps a peak during a 3-year period when my wife and I had the privilege of living in Hanoi and visiting many of my associates and colleagues in pathology regularly in their hospitals, giving lectures, providing consultations, and observing their processes. I was especially pleased to note that dream of helping to bring higher quality diagnostic to pathology to the laboratories in Vietnam was in part realized when the first CAP accredited laboratories in Hanoi received their accreditation over the past year. So we're moving forward on this journey, but let me talk to you more specifically about some of the things that may help accelerate this. And so how do you manage your laboratory for it to be a high quality laboratory? Well, this is not a new problem. And in fact, that was the issue that led to the foundation of the College of American Pathologists. This was established as a professional society in 1946. And over time has become recognized as a leading institution advocating for, promoting, and educating around things that help to improve laboratory quality. This happens in providing materials, in advocating politically as well as socially, and providing these services to a high number of laboratories in a large number of countries and still growing with a great number of global members, most of which, however, of course, are still concentrated in North America. So what does the CAP offer to laboratories, to pathologists? Well, The quality solutions are the biggest and main source of their offerings that provide help in this realm. But in addition, there are educational materials, publications, current events, sorts of things, resource guides for members, and to some degree, advocacy and integration with the House of Medicine. So what does an effectively managed laboratory really look like? Well, you would think there would be a number of characteristics that you would identify. The reports were delivered to the right people. They happened in a timely manner. They're cost effective, compliant with regulations, using high quality reagents and so forth. The report's understandable and has an appropriate interpretation. These laboratories are usually very service oriented, serving their clients and meeting the needs that they have. Also, the sample is appropriately obtained from the right patient. The test is performed appropriately. Well, you could summarize this by saying we got the right result of the right test on the right patient at the right time. And it was delivered to the right place and person in an understandable way. And that happens not just once or most of the time, it happens every time. So that's our goal. And that's what the CAP is really aiming for and tries to help us accomplish. So just to answer the questions that may have come up, we've already talked a little bit about some of these things. What is proficiency testing? What is external quality assessment? Well, this is distinct from quality control. This seeks to answer the question, are my results really accurate? And it involves processing unknown samples and obtaining statistical feedback that compares our performance with other laboratories. In contrast, quality control seeks to verify that the testing is accurate, but just at the level of the testing method or the testing instrument. Whereas proficiency testing verifies that the processes around testing, as well as the instrumentation, are accurate and performing as we intend them to. So these are both essential to obtaining a high quality result and serving our patients well. So this is one of the key programs of the College of American Pathologists, proficiency testing. But the other piece of this is laboratory accreditation. And this is an objective assessment that uses individualized technical checklists based on quality standards that have been identified by the College of American Pathologists, and verifies, therefore, compliance to these highest standards, externally verified, not just internally, asserted and claimed. So let's talk about the laboratory accreditation program and the value that this brings to a laboratory. So this involves several things. The most important of these are the specific checklists for each discipline in the laboratory, coupled with peer inspections and educational resources to help you comply and accomplish these goals or these standards that are established. These standards are not arbitrary. They're developed in conjunction with experts in the field, quality pathologists and institutions and organizations. There may be some regulatory component of them as well, but these are both key parts of this process. Well, why should you do this? What's the reason to pursue accreditation? Well, there are several things that can be readily demonstrated. One is that the personnel in the laboratory feel very supported, that they are providing high quality patient care, that they're not harming people by turning out inaccurate or wrong results. Furthermore, it demonstrates from leadership on down that there's a commitment to continue to improve the laboratory. This effort improves the efficiency, the cost effectiveness, and the consistency of the laboratory. and thus also can help to satisfy local or national requirements. Additionally, we have opportunities to collaborate or research other laboratories. So in summary, the laboratory accreditation process really benefits all the key stakeholders, everyone who's involved here. The laboratories are developing their programs and improvement that helps their employees as well as their financial status, their risk, and so forth. The clinicians and the patients have greater confidence in the laboratory, the accuracy of those results. The administrators, the insurers, or other agencies that are paying for testing can feel greater confidence that they're getting their money's worth, that they're meeting the standards and providing good care. And of course, then the public also benefits greatly from these higher standards that deliver improved health and safety to them. And thus, we see better patient outcomes. And that's good socially as well as economically. Additionally, accreditation helps to connect your laboratory with experts and peers to solve problems, to compare methods and results in ways that you wouldn't otherwise be able to do. So let's just pursue a counterexample. Let's say you're not an accredited lab and you turn out a result. So the doctor gets this result and it's unexpected. They weren't expecting the diagnosis of cancer, or they weren't expecting a sky-high potassium on their patient. But because the laboratory is not accredited and they've had bad experiences with the laboratory, Dr. V doesn't have great confidence in the lab quality. And so as a result, she may decide to just dismiss the result as an error. And she may then either seek to disregard it completely, or maybe retest the result, send the patient to a different laboratory, or choose a different test before acting on that test. Or potentially they may act reluctantly on this suboptimal result. And any of these are going to introduce delay and the potential for patient harm. And those are not the outcomes that we as physicians aim for. The CAP Lab Accreditation Program is based on inspections that are performed by your peers, people who are doing laboratory work like you are. They use very specific checklists for each discipline, and these are customized to the testing menu in your laboratory. And the processes that are evaluated include, specimen collection, all the pre-analytical materials, as well as the analytical and post-analytic processes. Now, we use this acronym ROAD to describe how the process happens. ROAD stands for read, or read procedures, observe processes, watch what's going on in the laboratory, ask personnel or patients about what they're doing and why, and then discover opportunities for improvement, discover areas of good practices or potential better practices. And then this leads to ongoing education, both at the time of inspection as well as afterwards, leads to inspired confidence on the part of the patients, the lab personnel, and others. And the checklists that are used are extremely valuable resource. They're openly available as a general tool. They're openly listed on the CAP's website, cap.org. But the customized checklists come as you enroll in the program and seek to obtain accreditation. These are the majority of the areas, the 16 areas where checklists are available, and they include for all laboratories these general and common questions and the director assessments. And then based on what services you're providing and even what areas within a particular domain you may be doing, these additional checklists will be added to your inspection plan. And now these are not static documents. These are updated annually and reviewed And those changes that are provided are posted well in advance so that you're not suddenly surprised by one of these new checklist items. You know how you're going to be assessed in advance. One observer, the Cleveland Clinic in Abu Dhabi, commented that these checklists are the most scientifically rigorous, customized, and objective requirements. They have clear requirements for evidence of, or clear objectives for what's required to provide evidence of compliance. And they provide education, guidance, and unequivocal method of assessing progress and compliance. Those are strong words of praise from an international user. Well, how does this whole process work? Well, it starts with engaging with the proficiency testing or external quality assessment program. In fact, you have to be doing this for 6 months, essentially 2 cycles of proficiency testing before you can then enroll and complete your application for inspection. So you begin with that enrollment, you get oriented to that, complete then after 2 cycles your application for accreditation. You'll receive the checklists that are pertinent to your laboratory based on your testing menu. And then a date for inspection will be scheduled. Eventually, over the period of time, you'll welcome those inspectors into your laboratory, usually in person, but more recently, occasionally virtually. And they will conduct a very detailed inspection using that road method that I just mentioned. At the conclusion of the inspection, there is a summation where they will report the findings for all to hear. Of course, as they find things, as things have been going on, they will identify those for you very clearly so that you can know either how to correct it immediately or over time. And then if there are deficiencies, you have 30 days to respond and correct the serious deficiencies. And finally, you'll receive your certificate of accreditation. Then a year later, you're going to perform a self-inspection to maintain your accreditation. And that cycle allows you to then continue and continue to improve in this process. Why do we begin with proficiency testing? Well, this is really where you begin to learn how to develop the quality systems in your laboratory to make your laboratory effective. And really, it's the experience that no test is so simple that erroneous results cannot occur. And any erroneous result can have potentially adverse outcomes affecting patient care. So there's really no risk-free or inconsequential harmless test out there. And so we believe that laboratories that have not been accredited before need to have 6 months experience in working with these materials. As you do this, you'll discover significant improvements beginning to happen. Well, how do we best learn from these experiences? Well, first of all, the results include detailed descriptions that allow you to compare your results with others that are maybe using the same methods or different methods. And then if there are areas where you are unsuccessful in that proficiency test, you fail it, in other words, or you have a near miss, that should lead to a deep dive or a deep exploration of your method so that you can uncover the cause and correct that circumstance so that it doesn't happen again. These materials are also very useful for ongoing education for your personnel. The proficiency testing usually is directed at decision points. And so making sure that your laboratory is performing around those decision points or those thresholds appropriately helps to ensure that you are operating a really high quality laboratory. Evidence of this is the fact that there are over 20,000 laboratories that are participating with the CAP's proficiency testing materials worldwide. Over 8,000 laboratories have been accredited using the lab accreditation program. And those laboratories come from over 100 different countries. So no matter where you are in the world, the standard is the same. We're not holding up one standard for one laboratory and a different standard, less rigorous for a laboratory in another setting. And that's the way you make your laboratory truly world-class. Well, we know there are other standards organizations out there and other accrediting agencies. So how does the CAP differ from the so-called International Standards Organization and their standard ISO 15189, which is directed towards medical laboratories? Well, first of all, who conducts the inspection? Well, peers for the College of American Pathologists versus professionally trained inspectors may be a little bit different approach. And while the CAP is also focused on technical procedures and quality management, the use of a checklist format and proficiency testing to verify performance is quite different from a much more process-oriented and in-depth root cause assessment of any problems that are identified that occurs on the ISO side of things. ISO is also directed very much towards prevention, whereas that is not necessarily a strong emphasis in the CAP. However, the CAP's results are much more relevant to daily operations of the laboratory and are widely applicable to a great deal of laboratories. In fact, the two systems are probably somewhat complementary. The CAP accreditation satisfies the deemed status needs in U.S. laboratories that are accredited with for payment by Medicare and Medicaid services, whereas ISO does not. So let's talk more about proficiency testing and how that fits into the process. So why do we do this? Well, we want that externally validated assessment of our performance. We don't want to just say, hey, we're doing a great job. We want some evidence that shows that we measure up to what the best in the world are doing. And that ability to see how your lab is doing relative to other labs that are using the same methods and instrumentation is very, very important. In some areas, of course, this is a regulatory requirement, such as in the United States and the United Kingdom. Over the time, we have seen the value of this to patient care. So when the first glucose proficiency testing samples were sent out in 1949, this was the result of all the participating laboratories. And as you can see, there's a very broad spread of results for a target value of 60 milligrams per 100 milliliters. That's really not great performance, is it? So how things have changed is this is a more recent result showing that there's very tight clustering around this target value with only very minimal numbers of laboratories beyond that. So this is clearly a great success story, but how does it apply in other areas? Well, we can look at hemoglobin A1c testing to see this above. So in these graphs, each of these vertical lines represents a specific method and reagent system that was reported by the users. Now, this testing was introduced in the early 90s, and as you can see, there is a wide a wide array of reported results around the target value here. And in fact, some of the methods were unsuccessful entirely in achieving even anything around that value. Over time, you can see that by 1999, most all of the methods were coming pretty close. And so the pass rate by method was 80%. 5 years later, it's nearly 100%. As you can see, just one laboratory that's where the mean and the distribution is outside the target value. Whereas now, 6 years later, you can see that, again, virtually all the laboratories are very tightly controlled around this target value. Well, how did this happen? This did not just happen by accident. This happened because of several things. So first off, the scientific basis and development of these materials, it comes out of subject matter experts on over 32 committees and 600 total personnel involved with this. Additionally, there was partnership with national or international standards organizations, such as the National Glycohemoglobin Standardization Program. These kind of results that we just saw were then fed back to instrument manufacturers, reagent manufacturers, who work then to improve their assays to get better performance and higher degrees of accuracy. And that then, of course, leads to better care. If we look today at how the results might be assigned, here are all of the instruments and methods that are used for hemoglobin A1c reporting. And as you can see, they have a very tight mean around the reference method of 5.21. All of them essentially within that. And most of the standard deviations are less than 0.1. Only one greater than 0.2. And the coefficient of variation, likewise, is really quite tight, indicating a tremendous level of process. This kind of information comes to you with each proficiency test that has a variety of instrumentation opportunities. And that then becomes a very useful tool in evaluating future instrumentation choices. So that's something that you might not even think about when you enroll in this. So what it can do for your laboratory, well, it's going to help you improve the laboratory practice and provide better results for your patients. You'll be able to see the state of the art in laboratory medicine and how comparative methods are performing. That helps you to select a better method when you have choices. And then you get insights from these peer comparisons as well as potentially satisfying regulatory requirements in your area. So how does this work? How do we run this? Well, ideally, you are using some sort of external assessment on all of the analytical testing in your laboratory. And you are utilizing it with all of your varying technical personnel, not just the best tech. Everybody participates in this. You test the samples along with other patient samples so that you simulate the experience of a patient as closely as possible. You follow the instructions, and then when something gets reported back or is wrong or there's a problem, you investigate that and find the cause. You uncover the source of the error so that you can then work to provide corrective action and learn from your experience not to do it again. And then finally, the director reviews all of these materials that you've done so that he or she also has a great degree of confidence in the laboratory. Sometimes when there's a failure or miss, it may uncover a systematic problem. And so that early detection will allow you to go back and test to see if any other patient results were impacted by potentially the same factors that led to failure on a proficiency testing event. So how do you choose which program to use? And the CAP is only one of several choices that are available internationally. And so you need to consider what's going to work best for my test menu. Is the range of challenges that are offered suitable to the tests that I'm doing? What's the turnaround time on these results? When I send in my results, how quickly do I learn the answers and get that back? What's the reputation of the provider? And most importantly is how appropriate are the peer groups that I'm going to be compared with, and how large are they? That's going to make a tremendous impact on the value of the information that you'll get back from this material. and the way these things are structured educationally, how they're grouped, various testing groups that may be in the same sample, for example, chemistries or hematology values. Those can all be decisions that play into the choice that you make. Well, we started with glucose in the 1940s, and now we're doing next-gen sequencing, but our determination should be to provide performance assessment via interlaboratory comparisons that is as valid today as it will be years from now. And these are important principles that should be followed as we consider this. We want to test unknown samples because we can't do it just with an identified quality control material. And allowing ourselves to see how other programs fare is also very, very important. So obviously, the CAP would like me to mention that there's a wide array of these materials. Some of them cover hematology, some of them chemistry, some of them specific analytes, single analytes like vitamin D. Some of them are related to transfusion medicine or morphologic issues, hematology, anatomic pathology, cytology, and so forth. These all can enhance the quality of your laboratory. Take a look over the catalog contents and see how frequently the tests are offered, what things are included in the various modules that can be identified. And you can begin this at virtually any time of the year. The catalog is adjusted annually, but that doesn't mean you can't begin your testing regimen at late in the year or otherwise. These products come out of a tremendous amount of volunteer work. The CAP committees, greater than 70 overall committees, 40 of which are scientifically oriented. These help to provide quality improvement solutions and review both the lab accreditation questions and checklist requirements, as well as help to develop and review the proficiency testing materials. Having participated myself in both of these processes, I can assure you that there is a great degree of expertise and dedication that goes into this process to provide the best value to the laboratories that choose to utilize these materials. So the CAP programs have a large number of programs. That means a large number of different product offerings in the various disciplines that we inspect around, and the peer groups tend to be very large. Additionally, the quality of the specimens is very high. The number of times when you don't achieve a consensus diagnosis for a specific analyte are very low. When that happens, however, you're not graded on what it should have been, but if everybody doesn't, if enough laboratories don't pass a particular analyte, then that analyte is not graded. And there may be some discussion about why that might be, and you can learn from those as well. So this whole process works as a repetitive cycle of improvement. The laboratories are provided with unknown specimens. They analyze them, return their results. The quantitative data is summarized, and the comparative reports are provided. You get your results back, compare those to your own individual performance, and then make improvements. And that whole process, that cycle is repeated, usually quarterly or trimester wise, so that multiple times each year you get the evaluation. So here's a sample, for example, from a histology evaluation where slide preparations were submitted for review. Review by volunteer experts who look at them and provide a grade. As you can see, you get your performance, And you see what the median grade was and the standard deviation for the various types of samples that were requested. We want to emphasize here again that this is not just for the best technologist, that each of your participants in your laboratory should engage in some part of this. Now, if in the event that you fail, you don't pass an analyte, and here's again another anatomic pathology test, the HER2 test, where you see that your result here was 3+, whereas the intended response was a 0 or 1+. Well, you've got to figure out why you reported a wrong result. And if you don't pass with 80% of your values being acceptable, you may be under, how would we say this, some stigma in terms of your ability to continue to report results for this test until you have rectified this. In certain testing domains, in certain settings, more than one failure can result in the requirement that you cease testing in that area, at least if you're a CAP accredited laboratory. If you're not a CAP accredited laboratory, you may be subject to other stipulations. But this illustrates the opportunity to then investigate. Now, maybe here the answer is, that samples were switched on the report or on the testing evaluation. And that may be easy to rectify. But you have to then figure out what's wrong with the process. How could this have happened? How can I make my processes more robust so that this won't happen again? Additionally, there are morphologic challenges such as the PIP program. Here you see the intended diagnosis high-grade serous carcinoma, and the participants in the PIP program got 99.2%. They got the answer correct of high-grade serous carcinoma. A comparable group, I think the PIPW, lower number of participants had a lower pass rate, and a number interpreted it as other things that should be investigated. And this helps us to evaluate and help to make progress. So these provide a great amount of results. As we've discussed this already, they give you education, a yardstick to compare with other laboratories, and opportunities for improvement. So in summary, the CAP programs that we've talked about, and truly in terms of things generally, any accreditation program or proficiency testing program is going to help you with two very powerful tools to improve your laboratory such that it really does become a world-class laboratory. Well, thank you so much for joining me. And I want to thank the College of American Pathologists who helped to provide some of these materials, and appreciate you spending some time with me. I hope this has been helpful, and I look forward to seeing you on a future program on our channel. So until then, thanks for joining me.